Hello, welcome to our Health Matters webinar series covering coronavirus, street reporting without the street. I'm Michelle Lavander, Director of the USC Center for Health Journalism. Thanks so much for joining us today. This webinar is part of our new ongoing series on ways to report upon and understand the policy implications of the coronavirus pandemic. Together, we'll be talking about finding sources and connecting with your community while covering COVID-19, often while sitting at your kitchen table with your laptop and your cell phone handy. Journalists are providing what authorities designate as essential services and telling human stories and documenting how local institutions are handling the crisis is critical. So how can you find out about everything from the challenges confronting a local nurse to how a pizza delivery worker is juggling having her kids at home while holding on to her job? We'll be focusing on helping you find voices from hard-to-reach communities that are often most at risk during the pandemic. And you'll have a chance to try out some of the tools we'll be sharing while on the webinar. Our session will be led by Amara Aguilar, a digital expert and associate professor at the USC Annenberg School of Journalism, where our center is based. Professor Aguilar teaches journalism for mobile and emerging platforms, social media, visual journalism, and interactive design. She was named a Toe Knight Disruptive Educator for Innovation in 2018, Media Shift's Top Innovation Journalism Educator in 2018, a Scripps Howard AEJMC Visiting Social Media Fellow in 2017, and is an Apple Distinguished Educator. She's also the founder of DMELO, the Annenberg School of Journalism student-run media brand that aims to reach young Latinx and Hispanic adults with stories and content experiences that matter to them. This webinar is offered thanks to the generous support of the National Institute for Healthcare Management Foundation and the Commonwealth Fund. You can tweet about the webinar at the hashtag coronavirus. A word about our format today. We'll be hearing from Amara first, and then we'll turn it over to our audience for questions. Because we have several hundred people on the webinar, we'll ask you to write your questions in the control panel's GoToWebinar. You can also write us there if you're experiencing technical problems, or just if you want to share or ask something during the webinar, and I'll let Amara know. You should also know that we'll be providing this PowerPoint afterward, and it's full of hyperlinks that will take you to some useful resources that Amara will be highlighting. And we'll be archiving the webinar at centerforhealthjournalism.org. Now let's turn over to Amara.
Hello, everyone, and welcome to the seminar, Street Reporting Without the Street. As mentioned by Michelle, my name is Amara Aguilar. I'm a professor at USC Annenberg, and I'm very grateful to have the Center for Health Journalism hosting this workshop. Part of what I do at USC, as Michelle mentioned, is work with a team of Latinx reporters who cover diverse communities and often overlooked communities. So what I hope to do is share some of the things that we've learned covering some of these communities with you today, especially as everyone's circumstances has changed. Many people are reporting from home. I myself am sitting here at my kitchen table as well. So we're hoping to bring to you some practical tips, digital tools that you can use. As we get started, I just introduced myself. I would love it if you would jump into the chat and introduce yourselves, say hello to everyone. Whenever you see this cat, it's time to jump into the chat. So we will actually have an interactive session here today, and I will have you jump into the chat 2 or 3 times as we cover some of these tools. So please take a moment, say hello, tell us where you're from, your news organization, and anything else that you'd like to mention. Michelle, do you see things popping up into the chat?
Not yet. I just sent a note to everybody to please say, oh, we're hearing from some folks. We are hearing from Abdul Basir. Maybe folks say what outlet and location you're in. Adam Glenn, a digital journalist professor at Hunter College in New York City, working from home in Sleepy Hollow, New York. Hello from Bozeman, Montana, from Jody Housen, a freelancer. Okay, Laura Castaneda, perhaps a familiar presence, our colleague at Annenberg. Ben from the Lockport Union Sun and Journal. Joy Williams in New York. Kateri Wozni, a freelancer in Los Angeles, and I'll just read one or two more. Callie Syringas, a journalism student at Hunter, and Michelle Charles, city editor of Stillwater News Press in Stillwater, Oklahoma.
Thank you. Welcome to all of you. It's great to have you here in the webinar. So I want to go over the three areas we're going to talk about today. We're going to look at digital search tools, tapping into groups, and also gathering information from your community, gathering stories from your community using callouts while you're at home. So before we get started, we want to remember a few things, especially when it comes to covering undercovered or marginalized communities. It does take time to build those relationships. I know with our experience, actually, Professor Castaneda works with me at USC with the DMLO team, our Latinx team. It takes a lot of time to build relationships with communities that maybe don't have as much experience talking to the press or have as much access. So many times our team is working with people that are undocumented. They're telling stories of people, of DACA students, first generation students, and it has taken time. Our outlet is 3 years old. It has taken time to build those relationships. We do make sure that we are informed as much as we can before reaching out, of course, to our community. There's many pieces of data that we can look at to really get to know our community. And when we look at data, we have this data-informed strategy, but what we really want to look at is gaps. Who are the people that we're not reaching? And that's something that we really try to keep in mind. We also try to be, of course, genuine, have empathy, and avoid kind of parachuting into communities. Many times, if something happens related to this community, a lot of times it's when news breaks or if something bad happens, we tend to like go straight to these communities to get the information that we need. But we really want to be developing those relationships beforehand. So I'm going to ask you guys a question and go ahead and jump in the chat. How do you learn about your community? I know that many of us are used to being out physically in the community, but now, you know, we've had to adjust even more with some of these techniques. So what are some ways that you learn about your community? Remember, when you see the cat, jump into the chat. So tell us a few ways that you learn about your community. Take a minute, and then I will also have Michelle read off some of those responses.
I'm seeing Facebook listservs and news outlets from Jody Housen. I volunteer with community organizations from Janelle Harris-Dixon. Subscribe to local media. I feel like it's slightly cheating to call on Laura Castaneda, but she says social media, Facebook groups, Twitter. Virginia Gaglione from La Opinion. We get calls and emails from our readers. Penelope Overton, Census Attention, the American Community Survey. Michelle Charles, Facebook groups show what people are thinking. Calvin Pinn, I've been tapped into mutual aid groups that have formed in my area. Reddit has been a good source too. And I'll read one more. Penelope Overton says clergy.
Excellent. Those are all amazing ways to learn about your communities, especially as many of us are going completely virtual with our reporting. And some things that we want to keep in mind as we are getting to know our community. There's so much to learn about our community. Many times when people think of diversity, they might think of race or ethnicity or background, but we want to also think, of course, about different areas such as age, you know, people's marital status, gender, their income, the values that they have, their beliefs, even their political beliefs, their stand on different issues. We want to look at where they're located, although social media and our digital space really does help us transcend geography, because we can now have communities that are possibly beyond our town, beyond our city, beyond our state. We can look at people's behavior as well. And behavior can be really important because this behavior can also help us know where to look when we're trying to find people and get in touch with them. So a few things that we're going to talk about today. We are going to talk about a little bit about search, which I think is a very basic tool you can use. Somebody mentioned groups in the chat. We're going to talk about groups, and then we're going to talk a little bit about callouts. But of course, other ways, from the research end, focus groups, things like that, surveys, spending time in the community, and of course, virtual time in the community. So we want to start looking especially for ways that people are coming together in the digital space, especially as we are all working from home. And I know our students are going through the same thing you are. Our media outlets are working completely from home. The school actually adopted a policy, that they needed to, not really come into physical contact with the public of people they aren't exposed to. So we're facing the same challenges that you are. As you're coming up with your plan, it's important to remember that you're not going to be able to reach everyone, and it maybe is not your goal to reach everyone. And that's why looking at some of this data and some of their behaviors can help you decide, well, how am I going to target these people? How am I going to reach them? What is the best way to connect with them? And one area that we can look at, as I mentioned, Pew Research Center does have a lot of great information when it comes to how people are engaging with online platforms. And we notice here, I've also in this slide linked out to this research. This research is in the US, but there's global data available as well. But just some snapshots, you can see the most popular online platforms by demographics. It's broken down by gender, and some is also broken down by race. So the reason why this is important is this can help us look at, okay, if we're trying to get a hold of, the Hispanic community, look at the usage, and we can see actually, I think somebody mentioned messaging apps, groups. Look at WhatsApp there, 42% usage there. By the Hispanic community, and we can see YouTube and Facebook and Instagram very, very popular as well. We can see African Americans there, the Black community, 40% on Instagram. So this can help shape, where we're looking for people especially when we're looking for diverse sources. Knowing about their usage habits is going to help us reach those audiences. I'm going to skip through to this assignment that I actually have my students do. We look at data usually at the beginning of our semester as we're planning out coverage. And we look at, in this case, we look at young Latinx audiences. And what we've had students do in the past is we've had them, these are just samples. Actually, I'm going to skip through to one that these are the ones they actually produced. They actually would create community cards based on what they've learned about their community. And we make this a visual assignment, and this is something that you can definitely do on your own. The students spend a couple weeks on this. I've actually done an assignment on this in workshops where people can at least get started in about an hour. And we look at, okay, who's our audience, and who are we trying to reach, and what are the gaps? What are some audiences that we may be overlooking? What are some of their personality traits? What brands are they interested in? What are their values? And this has actually helped. The first time the students produced these, I noticed that all of the young Latinx profiles they had them all college educated. And we had to do research in Los Angeles. Not every young person is in college, so they made some pivots there. So it's important to look for those gaps and really this really helps you visualize, okay, and humanize, who am I going to try to reach out to in my communities, and where are they at? And this is going to help us find the best way to reach them. So I included in the presentation an exercise you might be able to do on your own. Maybe you can gather a quick overview of your neighborhood. This is an exercise we do in our Engaging Diverse Communities class at USC. Look at data and then use some of the tools we're gonna dive into to frame some strategies and to frame some possibilities about how you can better reach your community. So this is one exercise that came out of this assignment. One reporter, this is actually a actual community reporter right here in LA. She covers Echo Park. She looked at data in her community, and she looked at actually census data from American Fact Finder. And she wrote about her perceptions of the community, some highlights of what she found in the community. And then based on that, she looked at, okay, what am I not covering? And where can I find these people? So she actually ended up doing several stories on housing after this assignment because she found that that was a gap in her reporting. So part of what we can do, the 3 areas that I mentioned where we can help start looking for what people care about and tapping into diverse communities is through search and listening. So I know many of you probably use Google on a daily basis. And we want to make sure when we are using Google, I'm going to start with this because we want to make sure our searches are efficient. So with Google, we always want to try to make sure many times this will be the first place we start, but we always want to make sure that we are using what we call the modifiers for Google. So I put some sample modifiers here in the slide so you can see them quickly. And I know many of you are familiar with some of these already, but these are things we want to remember as we're searching for sources and information. We can see here, I've typed in fever minus flu. We've typed in coronavirus, comma, and all of these text in red, these are all modifiers. So I can actually search specific sites, specific domains for coronavirus or COVID-19 information, and also search related sites here. So this can be very useful as you're looking for, as your starting point, as you're looking for information to cover coronavirus. Again, Google sometimes is our starting point, and this can help narrow things down and make things very efficient and save us time. So we do want to make sure, again, I've put a little slide where you can find your advanced search under settings, and this is going to help you narrow things down. Now, I put this one in at the last minute, but I know some of you may be familiar with Google Scholar. If you are not, here is the hands-on part, one section of the hands-on part of the presentation. Please go ahead in your browser while you're following along. Click on scholar.google.com. And the reason I wanted to show you this, if you haven't been there in a while, there is a special section on coronavirus coverage. So if you check that out, you can see here, actually I'm going to go back one slide. You can see here at the very bottom, there's actually curated sites and journals. And this is one place you can look at to find the latest research related to COVID-19. So what I'd like you all to do, I would like you to take a minute, go to scholar.google.com in your browsers. You could do this on your phone or on your desktop. Look through some of those websites. When you see the cat, jump in the chat. What types of articles might be useful to you? What types of story ideas might be useful to you? What type of sources might be useful to you? Take a minute, browse around there, and then Michelle will read out a few items that you have found. It's scholar.google.com.
I'm seeing Marcia Franklin is looking at the Lancet and finding that helpful. And by the way, another resource in addition to Google Scholar is something called PubMed, which is a repository of all medical studies, including some of the really recent ones that you can look at. I'm seeing Adam Glenn is saying he's looking at science. Crushing coronavirus means breaking the habits of a lifetime. Behavioral scientists have some tips. And then Michelle Charles mentions JAMA antibody testing, and Daisy Millman has actually a very important suggestion, which is ask some academic friends to help interpret the statistics and the jargon of scholarly articles. There's terminology that is really quite different from what you might think significant, statistically significant means something different from significant in layman's terms. I'll read a couple more. Vicky Diaz Camacho says she's finding some really interesting things in the New England Journal of Medicine on abortions during COVID. Mm-hmm. And Marcia Franklin is looking at ethnicity and COVID-19. And let me just see, Sabrina Weiss is looking at preprints. Preprints are this kind of early studies that don't go through the normal rigor to try to get out findings very quickly. But when you look at those, you should know that it hasn't been through the normal vetting process, which is very important. And we have been writing about that and how to make those judgments in our Center for Health Journalism.org weekly newsletter on COVID, which you can subscribe to from our homepage. And let's just see, here's another one. Justin Weitzer says, PubMed often has only abstracts available for free. You have to pay for the more recent articles. That's true, Justin, but there's something that says author information, and you can click on that and it tells you the university affiliation, and then you can reach out to any of those researchers, and 9 times out of 10, they'll be happy to send you the full information.
Mm-hmm. Excellent. So I'm glad you had some time to browse around Google Scholar, bookmark that. You can go back to it. One more tool from Google, because these are free tools. I like to share free tools. We have several more coming up in the presentation. But Google Trends has also curated search statistics around COVID-19. And so some of you may already be familiar with Google Trends, but for those of you who are not, Google Trends monitors search. So we mentioned Google a lot of times is the first place people go to find things. People will ask questions in Google that they are even afraid to ask out loud. And if I were to ask you, how many times have you Googled something when you've had symptoms of being sick? You know, this is very, very popular, and this is information that people want to know. So it can give you a really honest pulse into the insights and issues that your audience cares about. So I want you to—
Amara, we have a question here from Veronica Viafani, who says, does Google Scholar list sources depending on what's trending at a particular point in time?
Google Scholar is for academic journals, so it's not about what's trending, although it usually will list when something has been published, how many times it's been cited. But for Google Trends actually is indexing the amount of search for Google searches, Google News searches, and YouTube searches. So that's the data, which is more than 3 billion searches a day. And that is what Google Trends is indexing. And it's almost real time. It's within, I think, like 3 to 4 minutes that it's giving you results. So just to look at this tool really quickly, this is another hands-on section. Go ahead and click on that link in the chat, trends.google.com. There is an entire section once you get to that website. If you scroll down just a little bit, I think it's like the second or third section, there is a featured section on coronavirus. So what I'd like you to do is browse around some of those featured trends. I'm actually going to go there with you for this exercise. So we can see here it's the second featured area, but if I go into trends, there is a lot of insights here. It's showing trends in the US, but you can look at related questions that people are asking. Is Georgia reopening? When does everything open back up? What states are reopening? Queries, here's more trending queries as well. And then what's very interesting too is many times you can click on your regions. I'll click over here into Texas. And you can see search interest there. So you can also see the most searched terms, this is for the US in the past 4 months, are fever, sore throat, etc. So browse around this for a minute. And again, when you see the cat, jump in the chat. What are some interesting things that you have noticed looking at some of these trends? What is surprising to you? Trends.google.com, scroll down to the featured coronavirus section. And Michelle, if you can read out
Yeah,
a couple.
I'll read out some questions and some responses. Sabrina Weiss asks, is it possible to change the geolocation on Google Trends?
Yes. And you can go ahead and keep reading some more and I'll pull that up.
And so Calvin Pin says he's seeing lots of questions about oil stock. I'm guessing you might be in Texas, Calvin. And Clifford Chang says, I'm searching Asian hate crimes, COVID-19. It says not enough data. Wow, that's surprising. And then Jody Hansen is looking at the highs and lows of searches for unemployment. Chris Reber is looking at canine coronavirus vaccines. And Calvin says, no, he's not in Texas, even though they're looking at oil stocks. He's in Virginia. And then Michelle Charles says, lots of oil in Oklahoma. Marcia Franklin says, I'm clicking on Boise. There are 65 things to look at, but nothing comes up when I keep clicking. Maybe you could advise on that, Amara. And
65 then, 65 is actually the index of, like, out of 100 of how intense the search is in that area. So you'll just see a popover number. But if you go to the side panel and you go to explore, like I just typed in coronavirus, there is some data available for some cities. So I put Los Angeles in. Some people were asking about geography and cities. You can try cities and states in there. And then you can really kind of look again at a more localized version of some of this data. And it should show you some related queries and topics.
We've got a bunch more here. Do you want to keep going or do you want to move on with the presentation?
Go ahead and read a couple more.
So Piyushu Musari says, Indians are worried about lockdown extension, it seems, from the trends. And then searching for Pride Day cancellations are up 400% from Kali Syringas. And a question from Carolyn Adams, which seems like you kind of answered this already, which is, can you search for what people in a specific area are looking for rather than searching by a specific term or keyword? So I guess she just wants to know regionally, what are the concerns? And
yes. Mm-hmm.
So
so if you go to the exactly what I showed on the search, you should be able to type in a region and see some of those results. And there's also the section on that left hamburger menu called trending, and you can see what's trending, and you can also search there by area. So that should also help you with some of those questions. So very good. I hope that I can see that you found some very interesting topics, and hopefully this is informing some of the things that your audience really cares about. So a few other things, I'm going to run through the highlights of these just because of time, but I wanted to leave them in here for you to look at later. But of course, Twitter, you can search on Twitter, you can do advanced searches on Twitter. I actually pulled some terms that I found in trends and brought them to Twitter so that I could find more information about what people were talking about. And then Instagram, I mean, using the native search in each of the social media platforms is really, really helpful. So you can search on Facebook, Twitter, Instagram. I mentioned Instagram because it might not be the first place a lot of people look, but we want to keep in mind our young people and make sure we're looking for sources in that age demographic as well. I mean, not that everyone is young that is on Instagram, but it does have a big young demographic, 18 to 24s. So making sure we're also looking in Instagram, I think, for hashtags, looking for people that we could message. I actually also I also searched by geolocation. So I just searched a local hospital here, USC Keck Medicine, and then I was able to find a lot of people who were sharing their stories as they're going in to get treatment. Sometimes it was for themselves, sometimes it was for their family members. And this might be one way that you also find sources. So if you have an Instagram account, you can pull it up on your phone, and I might, say enter in some hashtags or enter in a hospital near you and see what posts come up. And this could again be a starting point as to getting a little bit of an inside look as to what is happening at these facilities and what's happening in these areas. I know with our students, we have a very diverse team on our Latinx team at USC, and many times their stories are informed by what they are finding on Instagram. And this can be really, really helpful as you're looking for diverse sources, I think. So go ahead, when you see the cat, jump in the chat. If you do have Instagram on your phone, pull it up, maybe search for your local hospital and see if you have any interesting posts come up.
Amara, while we're waiting for responses, we have an interesting question from Lawrence Carter Long, who says, how should one go about finding communities that don't generally live in the same neighborhood or geographic region, let's say the disability community, where people are at risk for both getting the virus due to underlying conditions and being denied care because of assumptions about the likelihood of survival? Many disabled folks are not born into families or neighborhoods of other disabled people. Thanks.
Yes, that's a great question. Well, I think actually social media might be one place to look, including Twitter and Instagram. Many times when people are unhappy about something or mistreated, they will actually go to social media and post about it. So that could be one area I think that you look at as you're working from home. So that could be something that you try. Did we have anyone jump in the chat and anything that they found on their Instagram as they were searching?
Not yet. We'll give it another little bit.
Okay. So again, right now people are feeling very isolated, and I'm going to go over this in a little bit, but social media usage is surging, especially on platforms like Facebook and Messenger apps and Instagram, because people are very connected. They want to feel connected to other people. And so that's one of the reasons why I think social media can be one place, not the only place, but it can be one place that we are looking to find people. People want to connect with each other, and the only way they can do it almost right now is virtually and through many of these platforms.
We're getting a few responses now. Michelle Charles says, I searched for our local hospital, but only found 3 posts. But I would say, Michelle, 3 posts is great. I mean, you could have 1 post, but it has really good info. Jody Hansen, when I put in a search, it gives me a bunch of choices of accounts, but not a general search function. I don't know if you have a suggestion for Jody, Amara.
You should see a little magnifier at the bottom of your app if you're on mobile. And then you should be able to type in some words. Go ahead, Michelle.
Jenna Flanagan asks, do you have any best practices for reaching out over Instagram or social media to people? Really good question. And yes. And then Greg LaRose said, The hospital Instagram accounts have photos of workers expressing thanks for donations. Similar thing from others. Another hospital's from Luann Schindler says they're posting photos of nurses and saying stay home. And let's see. Chris Reber, I found a picture of nurses at local hospitals wearing masks, thanking a restaurant for donating them lunch. Yeah, a lot of people are looking at their hospitals.
That's great.
And then, yeah, and a lot of sort of thanks for donations from hospitals. So that's generally what people are searching for right now.
Okay, good. So we're going to get to etiquette in a couple minutes when it comes to reaching out over social. Let me, I'm going to skip through some of the rest of these tips, but I am going to leave them. They're all in the PDF for you to look at. But if you also want to reach those tweens and the younger audience, TikTok, this is what they have, also a special section on COVID-19, and they are also curating a lot of content. And many times there's this one's from UCLA, there's doctors, there's nurses, there's patients in here. Many times people deal with stress by expressing themselves, and through this one from UCLA is nurses, I think, singing and washing their hands. Many times this is helping people to cope, and you can find people on TikTok as well. And there's a special section at the very top if you go to TikTok on coronavirus. So I put some examples for you. I also put some examples of how you can find people with tweet maps. So this is another tool you can look at. Because of time, we're going to kind of skip through and go through some highlights of these. Some of you may be also using CrowdTangle, which can basically monitor what's trending as well on social media and monitor hashtags. There's two things about CrowdTangle that I wanted to draw your attention to really quickly. The first one is they have a free Chrome extension that you can add to your Chrome browser. And this will tell you the referrals and where you're getting your referrals from for your articles. And where this can help you with sourcing is, number one, you could kind of see who's reading these articles and who's tapping into your articles. I did this with this LA Times article from yesterday. I put it into CrowdTangle using the Chrome extension. You can Google CrowdTangle Chrome extension, and it's also linked in this presentation. But this will be telling me who's sharing, who's mentioning my article, who's posting it. But what I look for is I look for what's not there. I look for, okay, which audiences are missing from here? Are more men sharing my article than women? You know, what are the background of some of these people? And this is what we look for, our gaps. And then we start to think, like, what are some things that we can do to try to reach out to those communities? The other thing that CrowdTangle offers, and I put the link in here for you, is a dashboard, a public dashboard that any news organization can look at, tracking COVID-19 and how it's being discussed on social media. So that is something really, really useful. It's public, it's free, that you can look at to see what conversations are happening. And again, we're looking at these conversations, looking to where we can uniquely contribute to coverage, but also what are the gaps in coverage? Because a lot of times some of this coverage can be repetitive. And where can we fill in some of those gaps? And then there are a few more tools in here that you can look through on your own. What I would like you to do is, actually, we'll skip this chat part too, just because of time. But actually, you can jump in the chat while I'm talking. What are some tools that you are using? What are some of your favorite tools that you are using to reach out to your community? So you can share those in the chat. We won't read them out, but you can hopefully see what other people are using. Because I do want to get to the group etiquette that someone asked about earlier. So another way that you can reach communities is groups. I mentioned that Facebook and messaging apps are seeing a surge in usage because people desperately want to connect with each other. So some tips that I put together from our own experiences, from looking at my students who are often tapping into private spaces, is is to be honest and transparent. I mean, the truth is we want to tell people's stories and make sure that their voices are being heard. So we want to be honest and transparent. And we may say, and there are many public groups that you can tap into, but we may say exactly that. You know, I'm working from home, but I want to make sure people's voices are heard and that your stories are being told. So that's one way to kind of frame approaching some of these groups. The public groups obviously are easier to get into, but sometimes some of these groups have questions where they're vetting you and they're asking you, are you a nurse or are you a medical professional? And that's in there, you can also be transparent. I know I may not be part of this community, working in this community, but I would like to get to know people. Or you can ask, can you refer me to some people that might be willing to talk? And so those are some ways that you might be able to tap into some of the groups. And I did some group searches. Somebody mentioned group in the chat um, on Facebook, but I also tried to look for affinity groups as well. I looked for Latina nurses. I looked for African Americans in health, Black Doctors Matter, etc. So I'm really trying to reach out to some of the groups that aren't often represented. So I'm going to skip through because I want to wrap up. You guys can kind of look at this on your own, but I want to wrap up because time has gotten away from us. But we do want to remember not everyone is on social media. So thinking about doing some call outs and having people reach out to you to tell their stories. I mentioned DMLO works with marginalized communities. One of the things that they wanted to do was do a call out so that people could recognize Latinx first responders. A lot of times we see people recognized and they're all from, you know, maybe one specific background, but we wanted to shine a light on marginalized communities. And this is one way to start building those relationships. So you're not just going when somebody dies or when something bad happens, but you're starting. This is a good way to start tapping into communities and building trust. So they did a simple form and they did it in English and Spanish. And it was a very short form, by the way. It was only like 5 questions. And then I put some tips in here for call outs. Be specific, have a clear goal, target a specific audience, and look for those gaps again in coverage that you can fill. So next, for the next Center for Health Journalism session, that talks about engagement, and I included some of those examples in here because not everyone is on Twitter, especially Twitter. Twitter is one of the actually least used social media when it comes to Facebook, Instagram, and Facebook and YouTube are the top 2. So thinking about text messages, thinking about mailers, thinking about reporting in multiple languages are really important. And you can also want to make sure what you're finding on social in these groups, you know, are credible. And I've included some resources for you. You want to look at people's profiles. You want to look at their followers, when and where the content was posted. Why are they posting about certain things? You can check the authenticity of images and video. Of course, interview multiple sources. And then I included some resources. One of an amazing organization that has a lot of resources on verification is First Draft. So I've included a link to their site as well. And then I want to wrap up with these final tips, and then we're going to take some more questions. And don't make assumptions about your community. Try to be active in the community right now. It's in virtual methods that we're using, but remember that people are multi-layered, not just one identity. Don't assume people want to tell their story. And of course, use care and look for those gaps and look to elevate those voices. Be kind and understanding. I know with our team, with our team, since our team is very diverse, oftentimes we have stories coming like through our feeds to our doorsteps. And you want to make sure, this is like one of my last kind of practical tips for this presentation, is look at your social media and audit it. Look at who you're following. How many men are you following? How many women are you following? What are the backgrounds of people? Look at age, look at race, ethnicity, look at occupations, things like that. There's actually this interesting tool that a woman in tech made, so that you could type in your Twitter address and look at by gender who you're following and look and see if there's room for you to improve. So I also included, finally, just to wrap up, some more resources for you. There's a few in here, but they have dozens and dozens of resources. And I hope that some of this information is helpful to you and you can use it in a very, very practical way as you go back to your newsrooms. And I also want to take a second before we get to questions to thank you all for all of the hard work that you're doing to keeping our communities informed. It's really life-saving information and life-saving work, I believe, that journalists are doing at this time. So thank you so much. I'll turn it over to Michelle so we can grab some questions.
Thank you so much, Amara. That was really excellent. So folks, you can type questions into the control panel. I'm just going to mention a couple, Amara, that we have already, and also just thank you again. This is so informative, and I think there's a real hunger for this kind of thing. Some of these are really specific questions. Ellen Pelagian says, can you combine terms to search on Instagram?
Yes, I was able to combine searches on those terms for sure. I just put a comma in between.
Stephen Scacazio says, I'm typing in hashtag Classroom 2020 in Instagram for a story on how seniors are doing. How do I narrow it down by region?
You can actually type in geotags, so you can type in cities or states.
And just a few tips or responses from earlier feedback that I thought might be worth sharing. Greg LaRose said, Nextdoor has good neighborhood-specific info, but the administrator has to give you permission. In my experience, most administrators are willing to work with me when I identify myself as a journalist. Similarly, Penelope Overton says, I'm honest when I join a group, but then I tend to lurk to avoid the gossipy stuff, but also due to time and my ability to participate. Is that okay? I find people tend to forget I'm there. How often should we be reminding people we're there? That's a really good question.
I mean, I think you should obviously tell people right away, but there are ways that you can remind people without saying, don't forget I'm here. I mean, if you're doing some call outs, asking your community questions, if you're regular in doing that, I mean, not over regular because you don't want to dominate their group, then people will remember that you're there. But that is one good way to have regular communication, is get their thoughts on things, get their input. That is one of the reasons why you're there, and people want to have their voices heard. And also I wanted to say, I had Nextdoor in one of my examples. I know it's been controversial, but lately, since coronavirus, I have found a lot of useful information in there. You do have to be a resident of the city that you get into, but as was mentioned in the chat, they will sometimes work with you and let you in. But I have found a lot of useful information about food for your neighbors, about services for children experiencing stress, about testing that I haven't actually seen anywhere else. So it's actually been really helpful.
Paulina Velasco says, any tips on how to use search terms in Spanish, but have it be results from Los Angeles and not a Spanish-speaking country?
Yes, you can actually search by language and by region in Google. So if you go to the advanced search options mentioned in the PowerPoint, once you click on the advanced search option, there are actually tabs for language and geographic regions that you can search in.
Jenny Darden says, what are good messaging apps to use? And we had talked a little bit beforehand about text messaging. Any advice there for folks?
Yes. I actually skipped through a couple of our examples that we had. Let me see if I can go back to it. But Annenberg Media actually a couple years ago launched WeChat because we had a large Chinese population of students. Um, so that was one that was really popular. And this is also based on some of the data about how people use social media and what languages they're using in chat apps, and what demographics use chat apps. So Annenberg Media launched WeChat in Chinese, and it now has over 4,000 followers, which is really amazing. WhatsApp is also extremely popular and has grown in usage. A lot of people from the Hispanic population are using WhatsApp. There are if you search on Google, there are some WhatsApp directories that you can look at, because I know you can't really search groups within the app, but there are some directories you might be able to tap into. Just remember, especially, we know groups are private, but messaging groups are even more private. People have moved to those spaces because they want more privacy. So you need to use extra care when tapping in there. But you can also start a group where you're presenting information, and this is what the WeChat does in Annenberg Media.
Let's see. I'm looking to speak to UK nurses and doctors for a story about mental health, but they've been instructed by their employers not to speak to journalists. How would you reach out to possible sources beyond unions, Facebook groups, etc.?
Well, I mean, this presentation focused on digital communities, but obviously calling people is still there. So, calling people there, talking to patients might be one way where you can try to get some more information and try to get started. Michelle, you might even have some more tips on that.
Yeah. I mean, I think one thing that maybe is there some way, Amara, for example, on Instagram or some of these other tools where they can maybe go and look at a region and then type in nurses, right? Don't you think that
Yeah,
could bring something up?
for sure.
And then if
Definitely.
one of those nurses, it seems like the hospitals are using this for sort of PR purposes, where they have a nurse holding up a sign to say thank you for the free coffee. But if they put a tag on that person and say nurse, Mary Sanchez, maybe you can then search for that
Yes.
nurse.
And you'll also have people commenting on those. So you can also reach out to people who are commenting, because a lot of times it might be people that know those people as well.
And Amara, how about putting open queries into some of these groups? It seems like there must be private groups for nurses in the UK, just as there are here all over the place. Maybe finding one of those groups and trying to
Yep.
knock on the door.
Sure.
And
yes. Doing a call out in the group or doing a call out. What we have found with the call outs, you can post a call out on your page or your Twitter page, but we have found with call outs, unless you already have a big loyal following, we are also sending those call outs individually to people to encourage their participation. We have found that personalized messages are more effective sometimes than just saying, hey, fill out this form.
And Amara, you had another slide about messaging in addition to WeChat. Were there some other messaging tips you had for connecting with different communities? I think it was the one right before the WeChat one.
Yeah. So WhatsApp, this one?
Yeah.
Yeah. So WhatsApp, they actually also have a whole section on staying connected with COVID-19. So you could see actually here in the middle of this slide, the second slide, a lot of medical professionals are using WhatsApp either to stay updated within their group or also to connect with patients. So I found this really, really interesting, some of these articles. And the fact that I think many healthcare professionals are using this app might make them more open to connect with you over these apps. So finding groups or even putting your information out there so they could reach out to you on the platform can be super helpful, because I think it's being used so much that it's becoming, people are more comfortable using it to make contact with others.
And then a number of people have weighed in on the chat to say, to go to their union and try to find former employees of a hospital and professional organizations. So just wanted to share that tip from Chrisanna Mink. Hi, Chrisanna. And then Pierre Marone says, what exactly is a call out?
Okay, sorry about that if I didn't define that properly. So a call out, I don't know if it's actually like a journalism term, but it's just like doing a call out to, like, posting a message like we did with Honor Latinx first responders. It's posting a message to people to send you stuff. And that could be things in different ways. For Dímelo, we used a form, a Google form. And we want to honor Latinx first responders. Fill out this form and tell us who you want to honor and why. And then we also, get some of their information. It could be that you set up a voicemail. Especially, this can be really useful, especially for people that don't have internet access, where you could say, leave us a message and tell us your story about X. So it could be a voicemail that you set up. It could be that you're having people submit photos to you during their hospital visits or etc. While they're on the job. So that's what I mean by call outs, where you're actually kind of soliciting and encouraging people to send you information.
And I just want to reiterate what Amara said before, which is, if somebody feels you're just diving in to write a controversial story, I think that's a harder kind of uphill effort. Whereas if you start out, as Amara's students did, with saying, who are our healthcare heroes in LA, you start establishing a relationship, you get a lot of names and connections, and then when you are going back to do that more difficult story, you've already established trust and you have a network. So thinking of this, I know it's so easy right now, we're just trying to move through stories really quickly, but to just take a breath and think that sometimes the long road is actually the shorter road. I know it sounds counterintuitive. I don't know, Amara, if you wanted to weigh in on that at all.
I agree completely. I mean, we've had this issue a lot of times, even at the university, where people would drop into these, even in person or virtually, to these private groups, and they're like, they don't really want you there. But if they know you and they know your record and they know that you care about the community, they are more likely to open up to you later on, and they're more likely to come to you later on because you've established that relationship with them. So I completely agree, Michelle.
We have a couple of questions that are almost not so much tied to social media per se, but just journalism in a broad way. One person asked, how do you talk to somebody about where someone has lost a life, or do you have specific tips on how to use care when contacting victim families? I don't know if you had any suggestions there.
Yes. The first thing is, of course, be human, be empathetic. And one thing I would say is, don't, a lot of times people are reluctant to contact people when someone has passed, but don't assume people don't want to talk. Don't make that choice for them. Let them make their own choice. And what I would focus on is, I would frame it as, how do you want your son, your daughter, your mom, your dad to be remembered? I think that is one thing that people are many times willing to share. And that could be a starting point of a conversation.
And Michelle Charles asked a question that gets at some interesting ethical issues. She says, I know that many private groups have, quote, what's said in here stays in here, unquote, policies. At the same time, some people tag me on issues. So how do you navigate that?
I didn't hear the question. Will you repeat that one more time, Michelle?
Sure. so Michelle Charles says, I've noticed that many private groups have what's said in here stays in here policies. At the same time, some people tag me on issues. So how do you navigate that in terms of what you use?
Well, I think you can take the conversation offline, right? So if groups have privacy policies where what happens in here stays in here, I mean, you don't want to violate that trust, but I think you can talk to people offline outside of the group, using your phone or conferencing or whatever, and then you can get them on the record that way.
And Imelda Garcia says, my question is, how can I search for groups in WhatsApp?
So you can't really search within, that I know of anyways, within WhatsApp, but if you search the web, a lot of people are putting, if they're kind of bigger groups, a lot of people are making WhatsApp group directories, and there's these really large groups that people are in. So you can't really search it within the app. But this is also where having a lot of contacts is super helpful, because that is going to broaden your network within WhatsApp, because all of those people that you have in your contacts may be part of some of these groups. And the more diversity you have, the more access you might have to different stories. But you can search some on the web.
We have a question. When reporting at home, how can you capture effective color and scenes?
Oh, so yeah, that can be challenging, but I think, one thing that my students have been doing is when they're on interviews, they're often recording the interviews with their phone, but they're having people say, show me where you're at, or show me what you're going through, or take me through your day. So asking those specific questions, tell me what you see, tell me how you felt. And also having the person you're interviewing, a lot of times we're doing these on mobile phones. The phones are very nimble and they can just turn the camera around and show you a lot of times what they're experiencing. And that can help add a little bit more color too.
Yeah. And any other tips for reaching people who may not be on the internet, who may have they may have cell phones, and just ways to find somebody who is not as connected, perhaps?
I think that it's very important. Texting can be one thing that you use. And as I mentioned, the messaging apps like WhatsApp, those can be very, very helpful. And then you want to make sure, you as the reporter, maybe that could be part of when you're reaching out to some of these groups. You're saying, hey, you can reach out to me over WhatsApp. But the messaging apps are, I think, really, really effective, and texting can be really, really effective for reaching people that don't have a lot of internet access. So that could be one thing. The other thing too is mailers. Back to basics. Mailing people things, or sending paper flyers or little postcards to areas where people are at. You can put them, I don't know, in the hospital lobbies and things like that, or mail them. I think that those things can be really helpful.
And I'll just mention something that we're using here at the Center for Health Journalism with some of our engagement work. Some of our media partners are actually putting requests for information or sharing information through handouts that they've partnered with the local food distribution folks to hand out.
Mm-hmm.
And so that's a way to bring some voices in that you might not hear otherwise and reach a certain population. Also, Amara, I don't know if this is in your slide deck, and you might have just not gotten to it, but you had shown us this fabulous slide that looked at different ethnic groups and how which social media tools they use more. And I thought that was so valuable. Maybe we could close with that slide.
Yeah, and yes, this is it right here. And I think you guys tweeted it out too. So it's on Twitter on the Center for Health Journalism's account. And Pew has so many statistics that you can look at. And again, this is just going to help inform your strategy and how you reach out to people. And there are also other studies. I know Annenberg actually did a study a couple years ago about specifically young Latinx audiences, and looking at what they're specifically looking for, family, music, culture, social justice, etc. So there's research that you can also find online in library databases or using Google Scholar that look at and examine media usage. But Pew is a great resource. And again, the more informed we are about how people are using some of these platforms, the better we are able to reach them.
Thank you so much. And one last tip, this is from Carrie Jensen, who says she's lived and worked abroad as a journalist, and meetup.com is also a great resource to meet people and sources by interest area. So
great.
Yeah, so I just want to thank both Amara for this excellent presentation and our audience for these wonderful questions and your participation. And please know there's a lot more information in Amara's PowerPoint, which we will be sharing online on centerforhealthjournalism.org in our webinar section. I also want to add that we've moved to weekly webinar series to serve reporters and our other audiences during this really very important time. And should you want to support this work, we're sharing some information here about how to do that. We'd be very appreciative. And I also wanted to mention that we will be surveying all of you. Take a moment to reply on your feedback on this webinar and to ask you what topics you're most interested in the future. And again, we'll be archiving this on centerforhealthjournalism.org. Thank you again to all of you, and to you especially, Amara.
Thank you, all of you. Be safe, everybody.